Good afternoon. Welcome to the first Healthy Montgomery webinar. This is a new webinar series that will highlight real-world examples of how a collective impact approach is improving community health in Montgomery County, Maryland. My name is Evelyn Kelly, and I represent the Institute for Public Health Innovation, also known as IPHI. IPHI is the official public health institute for DC, Maryland, and Virginia, and engages in partnership-based solutions to public health challenges and the promotion of health equity. Before we dive into the content and introduce our presenters, we have a couple of housekeeping items. This webinar is being recorded and will be available to watch again at a later date. We want to hear from you, so feel free to ask questions. If you are using the Zoom web app, you will see a Q&A icon at the bottom of your screen. Please type your questions there. If you are using the Zoom web browser, you will not see this function. Instead, please click the chat icon at the bottom of your screen, and we will forward your questions to the correct panelist. In order to ensure that all participants are able to hear clearly, all microphones will be muted. If you're having a hard time hearing the webinar at any point, please let us know via the chat function at the bottom of your screen. We also encourage you to dial in with your phone if you're having a hard time hearing through your computer. We will answer questions for each of the presenters at the end of the webinar. We encourage you to submit your questions as they arise. Now I'd like to provide an overview of Healthy Montgomery and the Transforming Communities Initiative, also known as TCI. Healthy Montgomery is the official community health improvement planning process for Montgomery County, Maryland. IPHI has worked closely with the county's Department of Health and Human Services on this effort since 2010. Healthy Montgomery is also funded by the 4 county hospitals, including Adventist Healthcare, MedStar Montgomery, Holy Cross Health, and Suburban. You may visit the Healthy Montgomery website for additional information. The Healthy Montgomery TCI is a collaborative partnership comprised of Holy Cross Health, IPHI, the Montgomery County Department of Health and Human Services, the Eat Well Be Active Partnership, and numerous other government and community partners that aim to address obesity and tobacco-free living in the county, and is funded by Trinity Health. The Healthy Montgomery seeks to promote healthy behaviors and prevent disease by influencing policy systems and environmental change strategies that influence those behaviors. The Healthy Montgomery TCI focuses on 5 strategies related to school wellness, tobacco prevention, community food access, safe routes to schools, and early child care nutrition standards. Today's webinar is part of a 2-part series highlighting efforts that are addressing food insecurity and obesity through the TCI. We invite you to join us for part 2 on October 16th. So let's get started with part 1, best practices implementing the Montgomery County Food Security Plan. We will hear from 4 speakers today, including Mark Hodge, who currently serves as the Assistant Chief Operating Officer in the Montgomery County Department of Health and Human Services, Thomas Tibbett, who is a Performance Analyst with Montgomery County Stats, Jenna Umbriak, who is the Director of Programs and Policy at Manna Food Center, and finally Amanda Nesher, who is a Food Security Programs Manager with the Montgomery County Food Council. Each speaker bio is included in the slides and on our website. I will now turn it over to Mark to get us started.
Thank you very much, Evelyn, and I'm glad to be joining you today to talk a little bit about how we live in Montgomery County through a cohesive network of collaborative partners, which include the Department of Health and Human Services, the Montgomery County Food Council, Manna Food Center, Capital Area Food Bank, and many, many more who are working on the county's 5-year food security strategic plan. Just to give you some background on the Montgomery County Food Council, we are an independent nonprofit formed by and led by individual community members and representatives of local businesses, government, nonprofit organizations, and educational institutions that broadly represent the food system both substantively and geographically. Our mission is to bring together a diverse representation of stakeholders in a public and private partnership to improve the environmental, economic, social, and nutritional health of Montgomery County, Maryland through the creation of robust, local, sustainable food systems. We accomplish our work through our 4 working groups, which reflect 4 of the major elements of the food system: food economy, food literacy, food recovery and access, and environmental impact. The Food Council, with input from its many community partners, co-created the Food Security Plan, which was released by the County Executive in January 2017. The plan sets out many recommendations to be followed over 5 years, with the ultimate aim of reducing the level of food insecurity in the county by 22% by the year 2020. The plan was developed from public discussion forums, listening sessions, in-person interviews, and roundtable discussion groups in partnership with more than 300 collaborators, including businesses, nonprofits, local and government agencies, and food assistance providers. The shared vision for the Food Security Plan was to make our community a place where all people at all times have access to safe, sufficient, nutritious food in order to lead fulfilling lives and contribute to making Montgomery County, Maryland a place where all live in dignity. The plan is divided into 3 sections: background and demographics, which consists of an environmental scan of existing resources and programs to combat food insecurity, as well as a closer look at food insecurity risk factors, such as changing demographics, language and culture, and vulnerable populations. Findings, which determines the populations most at risk, their specific barriers to food access, and the order of magnitude for those at-risk populations. Finally, the recommendations section sets out to the overarching strategy to reduce the level of food insecurity in the county, broken into year 1, years 2 and 3, and years 4 and 5. In 2016, at the time the plan was written, the National Anti-Hunger Organization, Feeding America, estimated 7% of the county's population to be food insecure, which worked out as 77,780 people, including 13.9% or 33,000 children. The most recent data from Feeding America show that the food insecurity rate has decreased to 5.9% of residents and 11.7% of children. While this is encouraging, there is concern that such a significant drop in the rate of food insecurity might not necessarily be reflective of an actual decrease in need, but instead might be a result of increased fear of negative repercussions due to the personal data collected in the application process. In addition, the recent press release published by the Department of Homeland Security on the issue of public charge will likely have a further negative effect on the number of people registering for federal public assistance programs, putting even further strain on the philanthropic community. The food data analysis tool created by the County Statistician's Office, and which you will hear more about in a few minutes, was created to aggregate many layers of local data in order to provide a more accurate and comprehensive picture of unmet need in the county. As you can see from the highlighted areas on the map, food insecurity was found to be prominent in the East County, Silver Spring, Aspen Hill, Wheaton, Gaithersburg, and Germantown. Research showed that there were varied, complex, and interconnected root causes for this level of food insecurity, and that certain populations in the county were increasingly vulnerable to it, namely children, seniors, people with disabilities, and the foreign-born residents. I want to draw your attention to the section on the far right-hand side of the slide, in particular to the sentence stating that living below the self-sufficiency standard is a risk factor for food insecurity. As a benchmark, for a family of 4 to live in Montgomery County with the most basic amenities, they would have to make an annual income of $91,252, which is significantly above the national poverty level of $24,300, and also the income eligibility level for SNAP around $31,000, or WIC, which is around $45,000. A huge number of people in Montgomery County fall into the gap of earning too much to be eligible for federal assistance programs, but yet not earning anywhere near enough to make ends meet. This makes our work in implementing the recommendations of the Food Security Plan all the more urgent and important as we work to connect those residents with programs and services that will serve to alleviate their struggle. I now want to hand over to Thomas Tippett, who is a performance analyst at County Stat and was in charge of creating the food stat data analysis tool I mentioned earlier, in collaboration with DHHS, the Food Council, Manna Food Center, and the Capital Area Food Bank.
Hello, my name is Thomas Tippett from the Montgomery County Performance Management and Data Analytics Office. Over the past year and a half, I have been working with the Food Council and other community partners to develop a shared measurement system around the food security strategy and its implementation, in the hopes of tracking the progress of our community's efforts toward making Montgomery County a place where no one goes hungry and all have their basic needs of food and nourishment satisfied. The first step to fulfilling this goal is to find an understanding and consensus around the available data pertaining to the who's, the what's, and the where's of food insecurity in the county. The Food Stat tool, which was launched on May 1st, 2018, was developed with input from many of our food assistance providers, the Food Council, and Health and Human Services professionals. We've developed this tool to be flexible for multiple audiences, from that basic end user that's looking to understand that 10,000-foot view of food security in the county, to the advanced user that's looking to program, collaborate, and inform stakeholders in his or her organization. So what is FoodStat? FoodStat is a geospatial data discovery and collaboration tool that allows food assistance providers, nonprofits, advocates, and policymakers to explore the whereabouts and severity of the vulnerable populations in the county, those that are most likely to be food insecure, and track the actions that the county and community are taking to address those needs. Secondly, FoodStat is a data repository for the best available data that can be used to guide the planning elements of the strategy and inform the public, stakeholders, and partners within our own food network. This enables our food network to be informed with the same information and hopefully will be a catalyst for communication, collaboration, and data sharing as we go forward with the implementation of the food security strategy. This is the FoodStat tool interface, and although this is the first generation of this tool, FoodStat will be continually developed as the data infrastructure and the capacity of our food network's stakeholders is also developed. Currently, we have 72 data sets that are either published or are publicly available within our publicly available publishing plan. These data sets are categorized into 6 categories, which include administrative boundaries, which includes school districts, council districts, and other important formalized boundaries, institutions and community assets, which includes geographic point data for community and government infrastructure, such as health and human services facilities, schools, hospitals, and other key assets. Food retail, which gives us as a community a roadmap to the helpful food outlets within our own community. Assistance and assistance providers. This both includes the location of our food network's food assistance providers in the nonprofit sector and the location and indicators of the utilization of state and local assistance programs such as SNAP and FARMS. The 5th category is transportation and accessibility, which includes all access points to the county's transportation network and gives us a look into the shortcomings of accessibility, not only to helpful food, but to other key necessities such as employment and healthcare. And last, but certainly not least, is demographics, which paints a picture of our neighborhoods and communities in the county and points us to a place where, as a community, we need to focus our efforts. This diverse array of data allows us to, as assistance providers and nonprofits, to explore and connect the dots between community assets, their respective service areas, and the households, communities, and families that most likely need their direct services. This tool allows them to communicate this notion and these ideas and this data effectively to grant makers, the private sector partners, and other nonprofit organizations. For instance, if I was a food assistance provider and I would like to explore the relationship between general vulnerability and, let's say, multifamily rental properties within their respective service area. Let's say I'm a service area in the a service provider in the Silver Spring and Long Branch area. Long Branch is the area south of 495 here and east of New Hampshire Ave. The end user could use one of the indicators of fiscal vulnerability, let's say the prevalence and density of SNAP households within Montgomery County census block groups, and would be able to identify the high need areas within their own respective service area to identify the number of SNAP households within that area and really get a good idea where they should be focusing their efforts. They can also navigate to another layer, the licensed rental properties within Montgomery County, and begin to see the relationship between these two data layers. And as a service provider, begin to use data to identify these relationships and begin to do education and outreach within some of these areas. As I mentioned, we launched this effort 5 months ago, and since then, we have seen a great value come out of the food stack tool. Since the release of the tool, we have built bridges across the food network using data and have collaborated across sectors, which has produced multiple curated data products that has informed our food network at large. Products such as a hyper-local service level demographics analysis, a comprehensive accessibility analysis based on the Montgomery County Transportation Network, and a client and education and outreach product that has given us a new way of looking at the clients that our food network already serves. The greatest value that this tool has provided has been the relationships that have organically grown out of the curiosity for data and its possibilities. Moreover, FoodStat has prompted an awareness and a need for further information and has begun to align the service network within Montgomery County with the priorities of the Food Council and the food security strategy. Next, we have Jenna Umbriak from Manna Food Center, our county's largest food assistance provider, to tell us about the Food Access and Recovery Working Group. We know it as FRAWG, which has been instrumental in forwarding the strategy.
Thanks, Thomas. Pleasure to be here. As Thomas said, I'll be talking to you about the Food Recovery and Access Working Group, which is one of the 4 working groups of the Montgomery County Food Council. This particular working group is largely made up of food assistance providers and has been instrumental to the implementation of several food security plan recommendations. FRAWG serves as a conduit for food security plan related information and feedback to those organizations who are best suited and in some cases mandated to carry out the practices called for in the strategic plan. FRAWG's subgroups, which are smaller committees made up of FRAWG members, allow for multi-sector workshopping of food security plan recommendations. So I'm going to take the next few minutes and go through some of the specific recommendations from the food security plan that FRAWG members are currently working on. Many of the food security plan recommendations for years 1 and 2 relate to increasing the capacity of and the connectivity between the numerous small food assistance organizations in Montgomery County. And when I say numerous, there are over 100. Before we could create a strategy to support all of these diverse organizations, we wanted to hear from them what support they felt they needed, as well as their preferred methods of resource sharing. So instead of simply sending out an online survey, which we did many of, we decided to have a large meeting and offer an incentive of free food and invited our current and prospective FRAWG organizations to this meeting where we used small groups and other interactive data gathering methods to solicit feedback on what were the biggest challenges that these groups are currently facing. What is their current capacity and their ability to grow? What are their barriers to growing their services? And what other stakeholders would they find useful to connect with that we could potentially bring into the group? We also began to gather data related to the specific food security plan goal to increase access to culturally appropriate foods. So in order to explore this a little bit, we asked what foods from particular cultures were being requested of food assistance organizations, but what of these foods were they not necessarily able to attain. Guided by the feedback from this survey, which we call the Training, Connectivity, and Resources Survey, or TCR for short, we use this in line with the Food Security Plan recommendations to develop best practices guides and facilitate innovative resource sharing where we're building a toolkit for food assistance organizations. The toolkit is currently housed on the Food Council website, and right now it's a collection of resources that include both existing tools and guides, as well as information and trainings created by FRAWG ourselves on topics we know our members are interested in. This includes links to several videos we've created on food safety for food security organizations, a report that the Food Council and a group of American university students created on the state of culturally appropriate food access in the county, and a webinar that organizations can use when training staff or volunteers to assist people in applying for SNAP benefits. In the future, we hope to evolve this now static resource into a more dynamic networking platform and resource hub that will have capacity building tools like these, as well as a consistent way for organizations to collaborate and share best practices with one another. The R in FRAWG is a nod to the element of our mission that is to amplify the work of the county's coordinated food recovery system, Community Food Rescue. FRAWG supports the Food Security Plan recommendations of expanding food recovery, so recovering more food, getting more people in the Community Food Rescue network, and getting more local producers to participate and to share more of these local products with all Montgomery County residents, with a priority on healthful food like produce. FRAWG provides CFR a consistent venue to communicate with current and prospective food recipient organizations that can be connected to the network of food donor businesses that include farms and farmers markets. Community Food Rescue provides capacity building mini grants that are designed to provide funding for cold storage, transportation resources, or other resources to get around common barriers that small organizations have to providing more food and healthier food. The Food Council will be reviewing these grant applications, actually have already done so, and the awards will be given out this month to groups that successfully connect their efforts to the food security plan goals, and also to highly encourage them to join FRAWG. So it's really a great incentive for those groups who may not be otherwise involved in our work to get involved. I hope you've seen how the broad Food Recovery and Access Working Group meetings serve as a place for groups and individuals promoting food security to get to know one another, identify opportunities for collaboration, and acquire and share resources. But achieving the more specific goals of the Food Security Plan requires the type of multi-sector workshopping that I mentioned earlier, and this happens in the FRAWG subgroups. Currently, we're forming a subgroup on culturally appropriate food access, and the subgroup charged with drafting nutrition standards for food recipient organizations is up and running. The most robust subgroup right now is the group advancing the connection between healthcare and food access. This committee has representatives of the 4 major hospital groups, safety net clinics, key community organizations, and other public health promoters like IPHI. All of these minds are working together on the Food Security Plan recommendation to expand Screen and Intervene, or we call Screen and Intervene. That is utilizing a validated 2-question screening tool to identify patients who are experiencing food insecurity, and then referring those patients to food access and wellness education. There are currently 2 place-based Screen and Intervene style initiatives in place in the county. One, the Long Branch Healthy Food Access Program that actually takes place in the area that Thomas pointed out on FoodStat earlier, and Food is Medicine, which you can hear about actually in a subsequent Healthy Montgomery webinar. Leaders of both of these initiatives are a part of this subgroup, and are providing lessons learned as we work to expand food insecurity screening to additional healthcare providers and other locations like Workforce Montgomery, which is a workforce development site, while creating a robust referral system to connect people who screen positive too. To date, this group has conducted interviews with key hospital staff to determine what and how screening is currently taking place. And actually finding little, we're creating a training for each care transitions team at each hospital to underscore the importance of food security to positive health outcomes and provide successful national models and explain the resources available to practitioners once the patient has screened positive. Because we know that practitioners are more incentivized to screen if they have a robust referral system and an easy referral system to connect patients to once they've done the screen. At this point, I'm going to invite Amanda Nesher to continue with the presentation. Amanda is the Food Security Manager for the Montgomery County Food Council, and she's going to elaborate on the Council's work to further Food Security Plan Year 1 and 2 recommendations, as well as give us a sense of what's in store for years 3 and 5 through 5.
Thank you, Jenna. As Food Security Programs Manager for the Food Council, I work with our many food assistance partners in the county, along with my counterpart at the Department of Health and Human Services, Deanna Tato, to help implement the Food Security Plan recommendations. I wanted to focus a little bit on some of the Food Security Plan strategies that speak to increasing outreach, knowledge, and best practice sharing among food assistance providers, and fostering further collaboration in order to more efficiently and collectively capture service data and understand the level of unmet need in the county. An important resource to facilitate better and more efficient knowledge sharing, both for Montgomery County residents, but also between food assistance providers themselves, was the creation of the Food Council's Food Assistance Resource Directory in 2017. The directory is a brochure containing a list of 77 food assistance providers in Montgomery County, including location details, contact information, hours of operation, the type of food assistance provided, and whether any pre-scheduled appointments or eligibility documentation is required. The PDF of the directory in English and also now in Spanish is available to download on the Food Council's website. Since finalization, over 3,000 hard copies of the directory have been distributed. Montgomery County Public Schools has twice provided the link to the online PDF of the directory in their elementary school lunch menus, which resulted in a huge increase in internet traffic to our website. The directory has also been distributed to hospitals, parents at elementary schools, clinics, libraries, Workforce Montgomery locations, community centers, county service centers, Montgomery College, and the universities at Shady Grove. At present, as I mentioned, the Food Assistance Resource Directory has been translated into Spanish, and the Food Council is working with County Council staff to translate the directory into 4 other languages for further distribution. The information contained in the directory has been added to 3 online mapping resources: Info Montgomery, Data Montgomery, and Food Finder, as well as FoodStat, and has been added as a knowledge-based article for the NC 311 information hotline to supplement food assistance information given to callers. In addition to this, the Food Council is working to turn the hard copy brochure into an updated, searchable online database, which should be up and running in a few weeks, and is partnering with the Food is Medicine program, which aims to integrate food assistance and nutrition education into Montgomery County's safety net health programs and build referrals to directory resources into their food insecurity screening. The directory has been used to refer food insecure clients to assistance programs on the Workforce Montgomery Youth Adult Opportunity Program, and we are working to introduce it at school health clinics in order to refer families of children who are screened as food insecure in their intake process to the food that they need. Last but not least, the Food Council is working with the county and other community partners to develop a SNAP outreach program that will consist of a group of dedicated volunteers who will travel to congregate meal sites, resource centers, and food assistance organizations to provide information about federal assistance programs, distribute the Food Assistance Resource Directory, and help to enroll residents who qualify for federal benefits. Montgomery County Food Council's Data Standardization Survey was created in 2016 in order to collect information about the data that is currently captured by the county's food assistance providers about the recipients of food assistance services and programs. The completed survey results were used to draft a recommended list of standardized data sets for food assistance providers to collect from their recipients in order to understand the scope of food assistance resources, more effectively measure the impact of services provided, and more accurately assess food insecurity in Montgomery County. The county's Department of Health and Human Services has asked all county grantees providing direct food assistance to complete the data collection spreadsheet as part of their grant reporting requirements for FY19. And in addition, the spreadsheet and guidelines have been distributed to the Food Council's FRAWG member listserv for voluntary completion. The data collected will be fed into food stats to provide a more accurate picture of unmet need in the county. Another recommendation in the food security plan was to explore food insecurity in certain new data sets, among them children under 5 and college students. For children under 5, the Food Council and Department of Health and Human Services is working with the Community Action Agency to conduct 2 listening sessions at their test center location in Silver Spring, one in Spanish in October and one in Amharic in November, with care providers and parents to understand in more detail the barriers to food access that they face, with a view to encouraging the implementation of policies and practices at the county level that could alleviate some of their struggles. And for college student hunger, an issue that's gaining nationwide attention and is the subject of numerous recent and troubling studies, the Food Council has been in contact with Montgomery College, the Universities of Shady Grove, and the University of Maryland College Park to facilitate listening sessions, educate about food assistance resources in the county, and discuss initiatives that can be taken to help alleviate food insecurity, from campus ad campaigns to destigmatize the issue, to the creation of food pantries, all the way to federal level advocacy to expand food stamp eligibility under the Farm Bill to cover students. As you can see here, I've listed out the recommendations in the Food Security Plan for years 2 and 3. Looking at the color coding, we are well underway with implementing them, as our speakers have already mentioned, and we're only at the end of year 2. I wanted to draw your attention in particular to the box about engaging community partners and the private sector. In 2018, the Business Leaders Fighting Hunger Coalition was launched by Burnett Communications and Sodexo. This coalition brings together many local businesses that want to give back to the Montgomery County community by putting aside money to invest in community building initiatives. They recently announced that for their first year, $75,000 will be invested in the effort to connect patients of safety net clinics with food resources. We've even made a start on some of our more long-term recommendations, those that are due to be completed by year 5 of the plan in 2021. Our Food Literacy Working Group has recently completed a food literacy assessment to catalog all of the nutrition, agriculture, culinary skills, and other food education opportunities in the county. And we are working with other partners to explore how to expand local school gardens and culinary training K-12 and post-secondary programs. We hope that we'll get a chance to speak to you again in the future to track our progress even further.
Right. Thank you all to our panelists. This was wonderful, and it was so great to learn more in depth about each of your respective programs. At this point, we're ready to answer some questions and comments that have been streaming in during your presentation. For those of you who have not taken advantage of asking questions, we invite you to ask questions or make comments by typing in the chat box or Q&A box at the bottom of your screen. If we do not get to all of your questions today, we will definitely follow up with individual questions that were not addressed and post the answers online. So I'll go ahead and get us started with our first question, and I'll open this question up to all of the panelists. How do you navigate this work in such a diverse county? What advice do you have for other jurisdictions with diverse populations and languages spoken. And I'll ask our panelists before responding if they could just mention their name so that folks know who is speaking.
I'll start. This is Jenna Umbriak. I mean, it is a challenge for sure, and I would say that it's still very much a work in progress. You heard me mention one of the food security plan recommendations, which is to increase the access to culturally appropriate foods. And so that really is a nod to our food assistance organizations to be very sensitive to the audience that they're serving and understand that just the standard American diet of food banks gone by, with your canned corn and your canned green beans, is not going to cut it without either a certain amount of education to people who are utilizing their services. So that's one thing you can do, is just make sure that you're holding cooking classes and doing demos and tastings to introduce people to new foods. Not to say that you have to stop providing certain foods altogether, but you definitely need to be taking people's hand a little bit and teaching them how to use canned foods, for instance, which is not something that a lot of people who are who have immigrated from Latin America or other countries, other areas of the world, they don't utilize canned foods or wouldn't be as familiar with them as people who were maybe born in the United States. So definitely education is a piece, and then making sure that as much as possible the inventory that's available can be diverse, both at the food assistance providers' perspective, and then making sure that there are retailers who are able to sustain themselves that are carrying a lot of the foods that are familiar to our neighbors who are from Eastern Europe or Western Africa or what have you. So, and I would say the last thing, and this is where we could do a lot better, and we're working towards this, is to get people residents who are from a lot of the who weren't native to the United States into these conversations, you know, to attend FRAWG meetings, to talk with us about these recommendations and how they directly impact their lives. And that's something that, you know, I would love to hear from people who are listening who have cracked that nut, because it is a challenge in order to provide childcare and accommodations to people who are who have a lot of challenges to just, you know, coming to a middle of the day meeting, so to speak. So those are kind of the three things I would identify that we're trying to do.
All right, thank you. Our second question asks, it would be helpful to give a bit more detail on distribution partners that are mentioned. I'll open that up to all of the speakers as well.
This is Jenna again. Distribution partners at food assistance organizations who are distributing food to the public. Can we ask that person to chat in the chat box a little?
We'll clarify that question. And in the meantime, I do have another question that's related to maps and resources. How often do you update these various maps and resource tools?
So if you're referring to the FoodStat tool specifically, we have a publicly available publishing plan for each and every data set, and actually the data sets that we propose to publish all have either a to be announced or an expected publication date. And that can be found at bit.ly/MCFoodstat. And you can scroll all the way down to the bottom and you can find our publishing plan that's available.
And to just add on to that, for the Food Assistance Resource Directory, that is the hard copy brochure will be updated annually. But once we have our online database up and running, that can be updated in real time as and when there are any changes to any information in it.
All right. So going back to that previous question, we got a bit more clarification. So it's actually around distribution partners for the food assistance guide.
Oh, people who are distributing the Food Assistance Resource Directory.
Yeah, Amanda. So again, the question is, it would be helpful to give a bit more detail on distribution partners that are mentioned, and this is specifically related to the food assistance guide.
So a bit more detail, well, what we have been looking at community partners through DHHS, different departments in DHHS, and trying to really understand what programs there are where there is an intake procedure that may not necessarily be someone coming for food assistance, but maybe coming for a different program, that we can then see if there's the opportunity to screen for food insecurity and then provide the resource directory as a referral mechanism.
This is Mark. The Food Assistance Resource Directory is also being distributed at places like WorkSource Montgomery. We are looking at a way to get them into the schools. As Amanda mentioned earlier, we are putting the link in the school menus. So when the parents receive those menus on a monthly basis, we're trying to get that link to the website in there as often as we can, so people have access to the online site. We're also looking at being able to target the distribution of the paper copies, but also providing people information about accessing it online as well in our SNAP eligibility centers. The reason for this is people may be eligible for food stamps, but they might not get their money that day and still be hungry. So, and maybe that money doesn't go far enough to address their hunger for the entire month. And so we can also provide the Food Assistance Resource Directory to them so they can access places like MANA and Capital Area Food Bank and the 100 other food assistance organizations that exist in Montgomery County.
Great, thank you. So we have another question that came in about how did you identify the best partners to distribute the guide, and what were the challenges they faced in working with partners to get the guide out?
So, as I said earlier, I think we were looking at county partners, both food assistance providers, but also county government agencies that would be touching residents, whether it's through childcare, whether it's through healthcare, whether it's through, as Mark said, WorkSource Montgomery, to try and really, as people come through the door, make sure that they have all the information at hand.
Right, and this is Mark, the other thing that we were trying to do is, and this is one of the challenges, is printing costs can be high. And so having the resource online is helpful, and most people do have access to either through a smartphone or through the library or other places where they can access internet, if not from home. It's still a sizable number of food assistance providers who are in the directory, and to be able to print that and have it available at libraries and clinics and all over the place. The issue isn't getting people to actually take them and distribute them, it's having enough of them on hand to give for distribution. And so we're looking for other ways of being able to share the resource directory that doesn't include the high printing costs. But I think so far anybody we've asked about distributing has been very willing to take that on and keep asking for more copies of it. So so that's really the challenge is having enough hard copies on hand. Right,
and now that we've had it translated into Spanish, there was a huge demand for that beforehand. So we're in the process of handing that out to organizations that requested that. And also, once we have the online searchable database up and running, it'll be a lot easier for somebody who is screening a resident for food insecurity to just type in a zip code and come up with a tailored list of food assistance providers tailored to that person who's come in. So you're not looking down a huge table to try and find the right food assistance provider.
Great, thank you. Thomas, we actually had a request for you to repeat the link that you mentioned earlier.
Okay, bit.ly/MC Foodstat.
And we'll go ahead and post it on the slides that we'll distribute afterwards as well, so everyone can get that information. So I do have another question in regards to challenges. I'm curious to know, what has been the most challenging part of implementing the food security plan in the county?
This is Madam. So I think that the diversity of county residents, whether it's locations, whether it's rural versus urban, whether it's demographics, whether it's language spoken, to try and make sure that everybody's voice is heard, and that we make sure that in the implementation of the food security plan recommendations, the solutions are really, really tailored to these individual communities. There may be a one-size-fits-all recommendation, but the actual implementation of it often is not something that that can be kind of a blanket implementation. So really trying to coordinate all of the different food assistance providers, make sure their voices are heard, make sure their concerns and their challenges are aired, and also to understand the different barriers that they face, try and take into account their different capacities, as well as, yes, making sure that everything we do is connected to community voices.
Right. And the other, this is Mark, the other challenge I think we have, and this is a 5-year plan. Certainly, we don't expect to solve the problem in 5 years, and we hope that it will live on past the 5 years. But the big challenge we're having now is forwarding the momentum that we have gained already. So at the end of year 2, we will have a new county executive and a mostly new county council here in Montgomery County. And so the food security plan initially came out of the county executive and county council's offices with a lot of momentum and promises to fund and move this plan forward. With a new county executive and a fairly new council, keeping that momentum going is going to be really important. So we have to kind of wait till after the elections in November to make sure that, that we speak to the right people about this, but that's going to be our biggest challenge over the next couple of months, is making sure that the progress we've made, the momentum we have with the food security plan continues with the new elected officials.
Now, in regards to FoodStat, what has been the impact of FoodStat since it's been launched? And do you know how many times it has been used or how many hits there have been to the web platform?
This is Thomas. The impact of FoodStat, I don't know if it can be quantified, but there has been this immense curiosity across our food network, food assistance providers, not only contacting the county stat office, but the Food Council and coming to FRAWG and really being engaged in using data to further the strategy and further their own work in their service area. The FoodStat tool has been viewed over 4,000 times. I'm sure that number will go up today by the sounds of it. But the actual impact, I think we will see that maybe a year or 2 from now, when we have this common operational picture around each and every provider, what their service area looks like, who's in it, and who they're serving. And that data just isn't there yet. I mean, we have maybe half of the pie, but we're still looking to fill in the rest to be able to really see where data has forwarded this initiative.
I'll also add to that for the capacity building mini grants that Jenna mentioned earlier, applicants were asked to justify their application by using FoodStat, by using the data in FoodStat to show why their specific organization was in an area that was at risk, high risk of food insecurity, and how the capacity building grant would affect their ability to provide greater service to residents in those at-risk areas. So that's another application of it that I think got people used to using it on a kind of more regular basis, but also really helped be able to understand the impact of the service people were providing.
Right. This is Mark. I think one of the biggest impacts that we will see, we probably haven't seen it yet, but one of the recommendations for year 1 was to get some more consistency across reporting for all the organizations. So as we mentioned, there's over 100 organizations. The majority of those don't report to anybody about anything. A large number of them, of those organizations, do reports, but some report in pounds, and some report in bags, and some report in other measurements. So there was a lack of consistency for that reporting to come to one place. And so now that FoodStat is here, and that we are asking people to report on more common measures, I think that will be the biggest impact we see from FoodStat over the next few years, is that information does get put together.
Great. So we had a question roll in about the funding of FoodStat. So who funded the development of FoodStat?
The county. Do you want to talk about county stat a little bit?
This is Thomas. So I'm part of the county executive's office, and we're at the performance management and data analytics office within the county government. And as the food security strategy came out of the county executive's office, and our office works to be that glue across those cross-sectoral and cross-departmental initiatives, such as the food security strategy. So I am really this kind of a matrix organization in this food network that's working to forward the food security strategy. So our skill set and our tools were able to develop this application and maintain it for the Food Council and the Food Network as a whole.
Right. So the FoodStat application is a small part of a larger county stat division under the county executive's office. So the outcome measures, budget measures, any data that's collected from county agencies and departments is often shared through the county stat website. The county stat also works with local nonprofits and others on some data issues as well. So FoodStat fit really well inside county stat, and so there wasn't officially any funding for it that happened. It just got absorbed into the county stat system.
Right. I think we'll go ahead and take one more question before we begin to wrap up. And this question is around compliance with the food security plan. You mentioned that groups might be mandated to comply with the food security plan recommendations. Can you speak to that a bit more? And how will food assistant organizations be held accountable?
So this is Jenna, and I'm the one that mentioned the word mandated, so I'll address it. Yeah, so there's two food security plan recommendations in particular where this language appears. One is for the nutrition standards that I mentioned. So in the original language of the food security plan, any organizations, food assistance organizations that get $25,000 a year or more from the county would be mandated to comply with, or in this, the food security plan recommendation around nutrition standards says that they need to reference an acceptable nutrition standard when they're applying or in their reporting. And the other one is what Amanda mentioned around the data standardization piece. So again, using this threshold of $25,000 or more of support from the county, those groups would be mandated to report the certain data sets that we're asking for. So right now, we're rolling it out sort of softly. Amanda mentioned that we've sent out the data standardization instructions along with the spreadsheet we're asking groups to fill out to the entire FRAWG member set to say, we'd really love for you to do this, and try to explain why it's so important and what their contributions to these types of surveys, data surveys, does and what it allows us to do, but not to mandate it at this point, given that there is, as Mark alluded to, so much difference in capacity of these organizations to collect this information. So we've asked that groups that are getting funding from the county report this on their yearly reports for the grants, but at this point, no one's been penalized for not doing it. And I imagine we'll follow a similar tack with the nutrition standards. So again, encouraging it heavily, making it a part of grant applications, and making it a part of grant reporting, but not necessarily penalizing groups, at least not in this first year, until we can support them in building the capacity necessary to comply.
Right. Thank you, Jenna. So we have now come to the conclusion of our webinar today. We want to thank our presenters and thank you, our participants, for joining us. On this slide, please find links to more information about today's topic. Within the next week, please be on the lookout for a link to the recording of this webinar. We will also post it online on the Healthy Montgomery and IPHI websites, which are listed on the slide. Also, stay tuned for part 2 of this webinar on October 16th and future Healthy Montgomery webinar series topics. On behalf of the Institute for Public Health Innovation, thank you for joining us and taking the time to participate in our webinar. Have a wonderful day.